Hi, it's Jude. Welcome back to @Jude Reform. Today, I wanted to tackle a subject that seems to have a lot of confusion behind it and make some sense of the debate. And that debate is about general anesthesia for facelift versus local anesthesia for facelift. So if you've been following my channel, you know that I have been making videos about my 5 facial plastic surgeries since June of 2023. At the time that I had the procedures, I was 69, I'm now 70. And people are so curious to know how the procedures went, especially the part about doing it under local anesthesia. In my case, I took Valium, I had numbing injections, and that was it. But you wouldn't believe how many comments I get, both in YouTube and on Facebook and Instagram, some of the groups I'm in, about how could you do it without being knocked out? Isn't that dangerous? That seems foolish. I would never do that. It's so incredible how brainwashed we've all become in regards to general anesthesia. So let's step back and let's look at the facts. And maybe if we have this discussion, you can make a more informed decision when you decide to have your facial plastic surgery. When I wanted to discuss this subject, it kind of reminded me of when I first got into the medical spa industry in 2005. I was in that industry for about 6 years, 7 years. And when I first got into it, literally people were freaking out by the concept of Botox injections. They thought that it was injecting poison right into their body. And it was just an unknown with a lot of fear behind it. Now, in 2024, when we look at Botox and it's so mainstream, it's fully endorsed, people don't have that fear. The fear is based upon lack of information. So let's conquer that fear. And I think when we look ahead, maybe to 2034, we will find that facial plastic surgery is being done under local anesthesia, probably at a rate of 90%. And it will be fully mainstream and fully accepted, just as Botox is now, versus when I started introducing Botox and literally had to put campaigns together as the marketing VP to explain to people that Botox wasn't going to poison them. I think that, we will get mainstream with local anesthesia as the pathway for plastic surgery in the same way that Botox came into its own, and we will get there. Really, the only pro is that you're knocked out and you don't have to conquer your fear because you're unconscious. And it's easy for the doctors, if they're struggling, if the procedure is difficult, the doctors can move you and place you and position you the way they need to, and you're not aware of any struggles they're going through. So those are really the only pros. There are a lot of cons. So for instance, when you wake up, you're going to be groggy for hours and you're going to be nauseous. You're going to probably vomit. You could be dizzy. When you're under general anesthesia, you have a breathing tube in you. So when you wake up, your throat may hurt, your vocal cords may have been affected, your speech may be weird for a little while. You may be hoarse, it may be hard to talk. Those are all things that happen with general anesthesia. And did you know that general anesthesia stays in your body up to 7 days? So it can take a full week to get rid of all those toxins. And during that time, you may be, feeling bloated. You may be feeling sluggish. You may have brain fog. The other thing about general anesthesia is it is the culprit behind the facial plastic surgery depression that you may have read about, where some women get depressed right afterwards, which I don't know. I was elated. I I was shocked when I heard that women suffered from bouts of depression after facelift, but it was explained to me that it's from the crazy chemicals that create an imbalance in your system and in your brain, which brings on those little temporary bouts of depression. It is important to really take into account the extensive downside that there is to general anesthesia. And there are other risks that impact your recovery. There's always a risk of death with general anesthesia, but it's very, very small. But the problem is that the general anesthesia does affect the veins and the blood, the circulatory system. So you do have to be worried about blood clots. And you can't get moving again as quickly, get on your feet as quickly as you can if you didn't have general anesthesia. Because of the effect on your veins, there's more bruising and there's more inflammation, so there's more swelling than if you didn't have general anesthesia. So all of those things are very uncomfortable to have to deal with. They create a lot of fear. They're very risky. And we've been brainwashed to think that we have to go through that tunnel to come out on the other side and get the benefits of the plastic surgery. Well, today, there are many more plastic surgeons that are choosing maybe not to just go with local, but to offer it as an option. When you're talking about local anesthesia, you can be talking about two different things. Let's define them. There is Twilight local anesthesia, and there is pill local anesthesia. So two different things. Now, if it was a ladder from very little to no risk up to a lot of risk, general anesthesia would be at the top. A Twilight Sedation, which is considered a form of local anesthesia, would be in the middle. And then the pill/numbing injections form of local anesthesia would be at the bottom with little to no risk. Let's talk about the middle of the ladder, the Twilight anesthesia route. When you're going to have your facelift by Twilight Sedation, you are going to have an IV put into your veins and a sedation drip or sedative anesthesia pumped through your body. And while you won't be made unconscious, you will be very relaxed and you will have an anesthesiologist. You will probably be in a surgery center and you will be monitored. Your vitals will be monitored and you will be a little bit out of it, but you will be relaxed. You won't feel anything. And a lot of people think that this is a really good compromise from general anesthesia, which is a pretty aggressive approach, to a much more gentle approach. So you're coming down on the ladder of risk to what we call Twilight or sedation anesthesia. And a lot of dentists use this when people are having extensive dental work. You don't save money in your facelift fees because you are going to still need that anesthesiologist and that surgery center. On the other hand, you're not going to have the severe side effects that you have with general anesthesia. You won't have all that nausea, the dizziness. You don't have to have a breathing tube in your throat. So there's a really nice argument for going the Twilight route. However, a lot of plastic surgeons want to untether themselves from having the anesthesiologist and the surgery center be a factor because they really don't think it's necessary. And this new wave of plastic surgeons, a lot of them tend to be younger, not those old timers, so to speak, and they're looking into alternatives to what's always been accepted and always been done. This batch of plastic surgeons are looking at and are offering even more gentle approach with little to no risk, and that is the local anesthesia with pill approach, and I had. Dr. Jean-Paul Uzzi of Jupiter, Florida is my plastic surgeon. Fantastic. I now look 30 years younger than I did look, so if you want someone that's amazing, I would tell you to check him out, and I will have his information in the description below. Dr. Uzzi only uses the pill and the numbing injections approach, the local approach, for plastic surgery, other than when he works with the nose. And when he does the nose job and he's working with all the bones in the nose and he's reconfiguring all of them, he, I believe, does use the sedation approach. For facelift, neck lift, brow lift, etc., lip lift, the way that he approaches it is you are given a prescription of Valium. You start taking your Valium on the way to his office. And then when you arrive, you're instructed to take a certain number of additional Valiums. And then they wake you up throughout the surgery and they ask you to take a certain number of additional Valiums at that point. You become very relaxed and very sleepy. Most people nod off. I did. I slept and I didn't even know I was sleeping. You know that sensation when you think you're really just kind of laying there, but you're really actually dreaming that you're dreaming. You drift off, you sleep, and what the doctor does is he injects you with certain specific numbing substances that will numb you in that area. You won't feel, for the most part, you don't feel pressure, you don't feel sensations, and you certainly don't feel any discomfort or pain. And then when they move to another area of your face, let's say they're going from the chin to the temporal brow lift, then they inject that area, etc., etc., etc. I was sleeping for about 4.5 hours, and that's what it took to get it done. And during that time, the only thing I did feel were the numbing injections. Now, he uses a special mix of anesthetic substances that reduce the sting and the burn of those shots. But the shots felt like Botox shots, so a little bit like a bee sting type of sensation. It's a little burn. It doesn't last more than several seconds, and you're done. Now, he's reported that some of his patients did feel some tugging and some pulling around the neck. In most cases, they were appreciative because they knew that he was getting rid of, the excessive skin and the droopy neck. But most people don't feel anything. And so it's like a true block. With local anesthesia, especially with the pill approach, you don't get up and feel groggy, unless of course you took like a lot of Valiums. I know there have been people I've heard about that have demanded a large number of Valiums, and there may be bigger people, taller people, they need a little more to get knocked out. But typically you get up after surgery, you wake up and they wrap your head and they put some Band-Aids on. You're not nauseous, you're not throwing up, you're not dizzy. You didn't just have a breathing tube removed, so you can speak fine. Your throat doesn't hurt. You feel a little bit beat up, but the inflammation doesn't really hit, so you're not swollen yet until the next day. So you don't really even look that bad. There's minimal bruising. You don't have to wear the compression socks. You're not worried about getting a blood clot. It's really a game changer, and it's a very different situation than knowing that you had this toxic anesthetic substance pumped throughout your veins, whether you had it in a lesser amount as Twilight Sedation, or you had it in a greater amount when you were knocked unconscious through general anesthesia. If you don't need to do that and you feel calm and at peace knowing that the doctor's there, his surgery nurse is there, they're monitoring you, and you're going to sleep, you're not going to feel anything. If you have that type of personality, or you're able to deal with that sort of mentally and it feels comfortable to you, then you might want to consider it. One of the beauties of it is that many people that have health issues, that have had chronic conditions where they can't go under general anesthesia, or simply due to age, they're able to still have the plastic surgery due to the doctors offering the local with pill and numbing shots approach. So it's really a godsend for so many people. Statistically, local anesthesia for plastic surgery has been proven to be safer, statistically, according to all the medical research that's been done. So if you're thinking about it and you're kind of weighing the pros and cons, and perhaps your doctor offers all three, the only advice that I would give you is, if you're going to have it done local with numbing shots and a pill, go to a doctor that does that routinely. because they're going to be very comfortable just going through the whole surgery that way. I would hesitate to go to a doctor who's done it once or twice but offers it as an option. They're going to be more comfortable with the surgery, doing it the way that they have muscle memory for, which could be with the patient under general anesthesia, or perhaps with the patient hooked up to an IV and doing it as a Twilight Sedation surgery. Find out what your doctor is used to doing, is comfortable with, has sort of a routine for, because you don't want to be the guinea pig to where he starts doing it and isn't really as sure of himself as he is when he does it in his normal way. I'd love to hear your points of view, your POV. I'd love to hear your comments. If you've had it done any of these 3 ways, what you liked about it, what you didn't like about it. For me, I had nothing that I disliked about having 5 procedures in 4.5 hours just taking Valium and having numbing shots. There was nothing disagreeable with me at all. It was all great. When it comes to recovery, your recovery will be easier, it will be faster, you will be up and ambulatory right away. Typically, when you've had local, you can go back to work or do your normal activities within 1 to 2 weeks. You don't need nursing care. You don't have the cost of hospitalization the night after the surgery. You just go home. You might be a little tired from, the mental stress of leading up to it, and then getting through it. But you're going to be feeling great within, a week, and by 2 weeks, you'll be seeing your friends again, and you're not going to have all of those side effects that I was listing in the opening of this video. So it's definitely something to think about. And again, I predict that in a decade, this will be mainstream, and we will look back and we will see that once this came into vogue and people knew that it was even possible, because most of your friends probably don't even know that you can have a facelift without general anesthesia. But once it becomes known and it's mainstream, I do predict that it will be the predominant way facial plastic surgery will be had 10 years from now. So look into it, do your own research. I am not a physician. Please know that this is just my own opinion and figure it out for yourself. So if you would be so kind as to like the video so that it will be shown to more people. We want to get the message out. We want everyone to know and to, kind of lose the fear about local anesthesia plastic surgery. So to do that, we have to get it in front of as many people as possible. So please like, share, and on a personal note, I would ask you to subscribe. We are trying to build the channel up, and once we get 1,000 subscribers, I can do live streaming sessions. We can expand in many, many ways. So I would ask for your assistance in liking, sharing, and subscribing. Thank you so much, and I'll see you on the next video. Cheers.